Walsh Protects You and Your Family presents the Singapore Parenting Festival. Join a series of 6 free webinars at Singapore's largest virtual festival for advice on your pregnancy and parenting journey, like having a safe pregnancy and delivery, getting ready for motherhood, nourishing your baby, building a special bond, ensuring your child's well-being, and giving them a head start in life. Register now. That's not all. Get awesome discounts and deals in the grand sale. Singapore Parenting Festival, proudly brought to you by MediaCorp and the Asian Parent. Scott's multivitamin gummies support your kids' growth. Dumex Do Grow, comprehensive nutrients. Try Milo with more milk and 50% less sugar. Nature One Dairy, your partner in parenthood. The following partners. And Shopee, #1 online shopping platform in Singapore. Shopee!
Straight away start the webinar, by the way. So yes, can we go to the next slide, please? All right. So I'm Shubda. You can call me Shub. I will be with you for this webinar. I run this humble website called as rainbowdiaries.com, inspired by, of course, the Asian parent. And I share a lot of content about lifestyle as well as parenting. I also run Social Media Mom Asia. It's a platform wherein we try to bring moms, mompreneurs, and local businesses together so that we all can care, share, and grow. So yes, now let's see the next slide. We have our expert, and thank you so much, Dr. Petrina Wong, for joining us for today's session. And thanks for taking out time from your busy schedule. By the way, Dr. Petrina, she is a pediatrician at Gleneagles Hospital, Singapore, and she comes with a rich experience of more than 15 years. She has been trained in various pediatric specialties, and in addition to treating the general pediatric conditions for babies and children, Dr. Wong also provides pediatric respiratory services like the evaluation and treatment of lung infections, wheezing, and asthma, as well as pediatric sleep services like the assessment and management of snoring, sleep apnea, parasomnias, and behavioral sleep disorders. Phew, I can't even speak, I can't even pronounce some of the terms. And our doctor, she is actually treating babies and kids for all these conditions. So thank you so much, doctor. And then, yeah, we've got, wow, the number of registrations and number of the participants is like constantly increasing. So I'm sure we all are really curious to know more from you. So over to you, doctor.
Okay, thanks, Shubhana, for the very kind introduction. Hi, everyone, and I hope everyone's comfortably at home or still in the office, maybe, or somewhere comfortable and relaxing. So in the next hour or so, what I'll be sharing with you is basically some tips that would be important for you as your baby grows, and what to expect, some common scenarios, some common conditions. And yeah, so I hope this session will be useful for you, okay?
Yes.
All right, so what we'll cover in this talk today, so we'll focus on the first 2 weeks first, when everything may get a bit overwhelming for new parents. I'll speak a little bit about feeding, poop, pee, and more. We'll next go on into development, growth, as well as vaccinations for your baby. And then we'll talk about weaning. This happens when baby's close to about 6 months old. And then I'll end off with some sleep tips for parents, okay, something that you may get a bit deprived of in the first few months, okay? So we'll try to sort of help everyone through, okay? Okay, so in the first 2 weeks, your baby has arrived, everyone's excited.
Yeah.
In the nursery stay, basically baby will get newborn checks daily by your pediatrician. Baby will get some standard blood tests done, and this is usually done from the umbilical cord that was joining you to baby for moms. And some babies may require some extra sugar checks. This happens in basically mummies who've got diabetes in pregnancy, or if baby is born too big, for example, more than 4 kilos, or if baby is born on the smaller side, less than 2.5 kilos as a rough estimate.
Oh.
So there will be some injections that will be done in the first few days, and this would be the vitamin K. This is done to prevent bleeding in your little one. And the standard jabs in Singapore that we recommend are basically the hepatitis shot, hepatitis B, as well as BCG. Baby will also get a hearing test done, and this is usually done in the first few days while baby is still in hospital.
Sure.
Okay, so now talking about feeding. So something that would happen really frequently in the first few weeks especially. So did you know, so basically colostrum, I think a lot of moms have read about it. It's basically, another name for it is liquid gold. So this is the first milk that moms produce when they first start breastfeeding. So this honey colored fluid, don't underestimate it. So it contains all the good nutrients that your baby needs. Now, in the first few days, your baby would pass dark stools, and this is what we call meconium. So it doesn't look like normal stool to a lot of parents, okay, but this is normal for newborns. These dark colored stools would gradually change to more normal looking stools in the first few days. Now, nearly all newborns would leave the hospital weighing less than their birth weight. So this is usually due to some water retention that they lose. And we generally expect babies to put back weight to their birth weight by about 1 to 1.5 weeks old. Okay, so breast milk provides the best nutrition for baby. It's got the right amounts of everything. So hormones from mom, nutrients from mom, as well as antibodies that will protect baby in the first few months, especially before baby gets any vaccines of his own. So try to breastfeed exclusively as much as you can. Some breast milk is better than none, okay? If exclusive breastfeeding is not possible, then formula milk is a good alternative or a supplement. Okay.
Got it.
All right, so something that is important that will be some instructions that will be given to you on discharge. So basically, baby would go home with the umbilical cord stump. So if you can just look at the picture on your right at the top, you see this blackish stump that is left at the belly button area. So this is normal. So majority of this stump would dry up and then fall off. In most babies, this happens about the 2nd week of life. Now, keep this area dry. So you dry it especially with a clean towel or a tissue, and then try to air it as much as you can, okay? So if the diapers are covering it, especially when the diapers are still baked when baby is just born, what you can do is you can fold down the upper edge of the diaper such that it exposes the umbilical area to air, and that usually helps to air dry it. Now, jaundice is the next big topic. I think a lot of parents have read about it and they usually ask, does my baby have jaundice? So jaundice basically is very, very common in newborns. And this happens basically because the immature liver can't clear the yellow pigment from the baby's body fast enough. So this accumulates in baby's body. Now, regular feeding and for baby to pee and poop frequently, this would help to stabilize the jaundice levels. There are certain treatment basically that we give if the jaundice level rises. And this usually depends on the age of your baby. And usually your pediatrician would advise you whether baby needs this blue light therapy, which is what we call phototherapy.
Right, right.
Yeah.
So, doctor, just to ask you this question, because yes, like you said, jaundice is very common. Based on my personal experience, my daughter was also under phototherapy for 4 or 5 days, and many parents must have gone through the similar experience. But just to check with you that are there any red flags or are there any alarms that as parents, we should not miss? What would you like to tell us about it?
Okay. Yeah, so thanks for the question, Shub. So a very useful tip for parents, basically always monitor the number of wet diapers you have for baby.
Okay.
Usually the yellowing can be seen on baby's skin, or if you just press gently and you release your finger, you can see sort of the yellow discoloration of baby's skin. Also, another useful area to check for jaundice is also in the eyes. Usually I advise basically parents to get the jaundice checked regularly in the first week of life. So usually a pediatrician would advise you, how often it needs to be checked depending on the levels when baby leaves the hospital. And usually a weight gauge is also important, because if baby loses too much weight or doesn't have regular wet nappies, that's something that may be a sign of dehydration. And definitely jaundice goes up when baby is dehydrated. So so follow the instructions of your pediatrician and have the jaundice checked regularly. Look out for poor feeding, or if your baby has a very sort of high-pitched cry, These are
Right.
signs that are not good to have. So
Okay.
consult your pediatrician early.
Okay. Thanks, doctor, because we already have, I think, receiving some questions also about jaundice. So thank you so much for this information.
Sure. Okay, so a lot of parents ask, what can I do with my baby at this age? Can my baby see? Can my baby hear? So bond with your baby as much as you can. I think treasure this first few weeks, okay? It flies, time flies, okay? So enjoy the first few weeks and bond with the baby as much as you can. So what you can do is basically make eye contact. Babies usually prefer to look at faces when they're young rather than toys. So always hold your baby near you and make expressions, talk to your baby, and your baby will slowly develop what are familiar sounds, and they'll recognize familiar voices as well.
Okay.
So the best time to do that is like whenever you're doing changing of diapers, which you're going to do a lot in the first few weeks. And also during feeding, make eye contact, speak to your baby. You can even sing to your baby. And basically, baby develops this bond with his parents through being held as well as through sound. Okay, so we're going to the next section. Okay, so something very important, development, growth, as well as vaccinations. Okay, so developmental milestones is something that will be tracked by your pediatrician, and definitely something that you would, as parents, want to know as well, whether your baby is tracking along the milestones well. So at the back of your baby's health booklet, there is some useful information. So you'll get a book, which is what we call a health booklet when baby leaves the hospital. There's a parent sort of questionnaire at every stage, for example, 0 to 2 months, and then 3 to 6 months and beyond. And you can refer to that sort of questions, is your baby able to do this? Is your baby able to do that? And that's quite useful information for parents to follow. So now, at about 6 to 8 weeks old, baby can look at your face and you find that baby will give you his or her first smile. They can follow the movement of an object. So I always ask parents, if you walk past baby's cot, does baby sort of track you as you walk past? And close to 2 months old, most parents would find that, hey, my baby can actually follow and sort of follow me as I walk past. So baby will also be a little bit more vocal. So baby may make baby cooing noises. So R, U, E, A kind of sounds.
Right.
And if you put baby on tummy time when he's awake, you find that baby's neck gets a little bit stronger. So baby can actually lift the neck transiently off the cot. Okay. So these are some milestones that are tracked as baby grows up. Okay, so next slide, please. Okay, so when your baby is about 3 to 4 months old, baby can grasp. So for mummies with long hair carrying baby, you'll find that baby would catch onto your hair. If you give a rattle to baby, baby can actually catch on to something in the hand. Baby can now sort of follow the movement of an object. So when I say 180 degrees, what I mean is that from left all the way to right. Okay. Baby can laugh out loud, okay, and tummy time wise, baby's neck is much stronger, so baby can lift the head and chest up from the cot. This is the time at close to about 4 months old that babies may successfully flip. So just be very, very careful and don't leave baby unattended to run to the bathroom, because sometimes at this age, baby may surprise you by just doing a flip by himself.
Oh, wow.
And basically, it can get a little bit dangerous if parents were leaving a baby on their parents' bed without any railings. Okay, so at this stage, basically between 3 to 4 months old, baby's neck is pretty strong, and baby can basically lift the head up with minimal support, and the head is quite steady. Okay. All right, sitting usually comes a little bit later on, between about 6 to 8 months old.
Okay.
Next slide, please. Okay, so something about growth, something very interesting. I think a lot of parents tend to want numbers. So I've got some sort of numbers here for you, just as a gauge to know how much baby is growing. So baby basically triples his birth weight in the first year. So expect your baby to double the birth weight by about 5 months old. And from birth to about 6 months, your baby basically gains about 140 to 200 grams a week. So that sort of averages out to about 20 to 40 grams a day. Now, in terms of length, baby may grow about 1.5 to 2.5 cm per month at this stage. So there's a lot of rapid growth happening in the first year, and it's an exciting time for parents to track the growth as well.
Sure, sure. Amazing information, doctor.
Yeah. Next slide, please.
Yeah.
Okay, so vaccinations. Okay, so on to a painful topic. So a lot of parents get really worried about vaccinations, and they always ask, when is my baby next due for the vaccinations, because they need some mental preparation. So vaccines are important because they help to keep your little ones safe from infections as they grow up. Just bear in mind that not all infections have got vaccines available. So what is recommended basically locally is based on what are the diseases that are prevalent in this area, and over the years, basically what are important vaccinations to have. So again, if we refer to your baby's health booklet, you'll find the vaccination page at the back, and I'll share with you in the next slide as well what are some of the recommended vaccines that are important for your baby. So when your baby is immunized, basically his or her body basically produces antibodies to fight off that particular disease. So it needs time for that to happen. It doesn't happen immediately. Now, always keep to the recommended schedule for your baby. So try not to delay jabs unless your baby's unwell or for whatever medical reason that the doctor advises to delay. If not, try to keep to the recommended schedule, because that has been found from research and evidence that basically that sort of keeps baby's immune system boosted at the right times. Now, in terms of side effects, which is something that I think all parents worry about, like is it going to do more harm than good? The answer is no. So vaccines generally are pretty safe. Of course, I mean, there's pain involved, but that's transient. And some of the more common side effects include fever, some soreness or pain at the injection site, maybe a little bit of reduced appetite for that, 1 to 2 days after the vaccine. And in some vaccinations, there may be a rash that may be expected. Right. So usually with each jab, you will be given some advice by your pediatrician, like what are the things to expect in the following days after the jab, so that you are aware of what to watch out for.
Right.
So in my next slide,
Yeah. Oh, okay. Yeah. This is what I wanted to check. Yes.
Yes. Yeah. So in this slide, you sort of have an overview of the vaccinations that your child would get as he grows up. And you can see that this has been revised actually pretty recently from November last year. So nothing really much changed, just that the scheduling of and the timing of the jabs sort of shifted from the old schedule. So you can see that at birth, baby will get the 2 jabs, the BCG as well as hepatitis B. And at 2 months, 4 months, and 6 months, you see multiple sort of colored boxes. But don't worry, some of these are given as combination vaccines. It doesn't mean that your baby's going to get 4 different injections. Some of these are just combined into one. Okay. Now, this is the schedule all the way up to primary school and beyond. So in the first year, you realize that most of the jabs are concentrated in the first year. And after that, they're a little bit more spread out. And most parents go like, phew, like I have a sort of a break. Yeah. True. Okay, all right.
So doctor, just wanted to ask you one question. In fact, we have people asking that question already, that we all know we are in a pandemic currently. COVID-19 is just like, don't know, not going at all. So is there anything specific for babies? I mean, is there any special vaccine or something that we should consider for our babies as far as the COVID scenario is concerned?
Sure. So I think at this stage, I would say that for COVID vaccine in particular, that's what you're asking. Basically, the COVID vaccination for now is basically meant to target the adult population. And I mean, basically studies have largely been done in adults and not children. I think the next phase, basically, we're looking at vaccinations for our teenagers. So between 12 to 16, I think that's the next group that, we're planning to target. Oh, okay. But certainly not for the newborns or for the younger children as yet. But I think, like what you rightly said, we're right in the middle of the COVID situation, and it doesn't look like it's getting better anytime soon. But for now, there's no vaccines available for COVID for the young ones, and for the newborn schedule, I mean, there's no change for that right now.
Understand. Yeah. Okay, so what do we have before? By the way, please note, Dr. Wong has got a lot of exciting topics coming up for us, but before she continues, look at your screens, guys. There are Shopee vouchers up for grabs, And there are first 200 of our webinar participants today. They are going to get $3 off. There's no minimum spend required. Just go ahead and shop for all the toys, kids, baby category of products on Shopee. And yeah, by the way, can I buy toilet paper also with this voucher? Okay, anyway, just kidding. So just go ahead and start your shopping. There's a QR code, as you can see. And I guess in the chat window, we have put the link also for you. So you can just click on the link and get your voucher, as well as that QR code is also there. Just flash your mobile cam, go ahead and start your shopping. By the way, terms and conditions apply. This voucher expires 23rd May. So do not miss that, guys. Okay, so I'm going to give you some movements so that you guys can scan. We have got, wow, the list, the number of participants is very huge. So I guess let's give them some movements. Go ahead. And by the way, one more reminder, guys, while you're availing of your Shopee vouchers, do note that please submit your questions in the question and answer box, because I can see some really good questions, but they are coming in the chat window. So we would answer questions that are submitted using Q&A box. So just a reminder. Yeah. All right. So Shopee time. Okay. So I guess, yes, there is one exciting poll coming up as well. Before we discuss something with Dr. Petrina once again, it's a very important topic. All parents, they are looking forward to this time. That is nothing but the weaning method. And when the baby starts taking their food for the first time, it's like magical moments for parents. So look at that poll, guys, and tell us very quickly. So what is your preferred weaning method? Do you prefer the baby-led weaning, or is it like puring, or a mix of both? Just go ahead and yeah, just vote for it. We will be discussing the results later, so your participation is very much necessary. Go ahead, take your pick, and then we will see the results very soon. Baby-led weaning, puring, or a mix of both? What do you prefer, or what will you prefer if you are going to be would-be moms and all? Some cool questions coming up. Please flash them in question and answer. And yeah, look at that. We got the results. Wow. So doctor, if we see the results of this poll, baby-led weaning, about 19% of the people. Puring is a preferred method for about 12%. But I think a lot of parents, they would like to try both, a mix of both. 69% of them. Wow. So yeah, so over to you, Dr. Petrina. What do you think is good, and then what do you suggest as far as baby weaning is concerned?
Okay, so on to another exciting topic. So weaning, yeah. Okay.
Yes.
All right. So it looks like I think the majority of the audience choose to do a bit of both. So like the conventional weaning method as well as some baby-led weaning.
Sure.
Okay, yeah. So next slide, please. Okay, so what is weaning? All right, so weaning basically is the introduction of solid foods to your little one, and this usually happens between the ages of 4 to 6 months.
Okay.
I usually say that, you can probably start at about close to 6 months old, okay, unless, advised to start earlier, okay. So as baby grows, the digestive system matures, and basically baby's nutritional and developmental needs for the body also changes. Right. So at about this age, baby's needs increases and milk may not be fully enough, and that's when you want to introduce some solid foods to meet this increased requirement. So the milk intake at this stage basically would range between about 500 to 750 mils a day. Of course, some babies may take more, some babies may take a little less, so it really depends from baby to baby. Now, what foods are recommended? Generally, you want to start with some iron-rich foods first. And the reason why is because at this age, the stores of iron from birth would have slowly sort of reduced over time. So look for cereals that are iron fortified, And natural foods that contain more iron basically include spinach. You can use the stock of red meats, for example, for babies, cereals or porridge. And other foods that are suitable would be things that can be mashed up, such as pumpkin, sweet potato, carrots. So these are suitable foods as the first foods.
All right.
Next slide, please. Okay, so now you have this sort of diagrammatic sort of visual chart. And you can see that when you start at 6 months old and you progress for the next 6 months up to about 1 year old, you realize that, you know, how sort of smooth or how sort of lumpy the foods get changes. So at 6 months old, when you first start, you basically want to start with a very smooth puree. And this basically gets lumpier and a little bit less smooth. And babies able to take these when babies between the ages of 9 months to 12 months. At 6 months old, you still want to keep generally foods that are fairly smooth and easy to swallow. Okay. All right, next slide, please. Okay, so baby-led weaning. So something that was an option in the poll, and I think probably a lot of parents have read up on baby-led weaning because there's lots and lots of information on the internet on this. So what is baby-led weaning? It's an alternative method for introducing foods to infants. So the conventional method is basically feeding baby with a spoon. With baby-led weaning, baby basically picks up the food and puts it in her mouth without being spoon-fed by an adult. So this was made popular first in the UK, and then after that became pretty popular in the US and then New Zealand, and basically caught around the world. So there are numerous blogs, internet sites, online forums, all talking about baby-led weaning. So the potential benefits that have been brought up with this entire topic is basically it may sort of encourage improved eating patterns because baby learns to explore with the fingers, put it in the mouth, and that's something natural to do rather than being spoon-fed by, you know, the caregiver. Now, some of these basically information that has come out from this baby-led weaning is also maybe it might sort of help babies self-regulate hunger because baby would know when to stop if baby's full rather than being fed, you know, until the caregiver thinks that baby is full. So there are some sort of pros and cons with regards to baby-led weaning. And I think in terms of scientific evidence, it's not entirely clear if it's superior to the conventional method. Is it better? Is it worse? But I think it's really something that parents do want to sort of find out more information for first before making that decision. Now, there's still lots of unanswered questions, like, you know, with regards to, does it really do a lot more good than the conventional method of weaning? Yeah. And I think not everyone is comfortable with letting baby sort of mess up the entire place and putting food in the mouth without actually making sure that baby gets a substantial amount of food going in. So I always tell parents that, you know, it's not something that would suit everyone, and it's not like a blanket rule that, you know, every baby should be feeding by baby-led weaning method. Basically, I think a good idea is basically for parents who want to give it a try, I would say that you can do a bit of both. So like in the poll question, I think a lot of audience was actually comfortable doing a bit of both. So both spoon-fed by caregiver, as well as maybe letting baby sort of do a bit of feeding himself. I think that's a good balance, and you can sort of tell from your child's behavior whether that's something suitable for your baby.
Right, right.
Yeah. Okay, so next slide, please. Okay, so the next section, which is the last section of my talk, is basically sleep tips. Okay, so all right, so you can see that in the age group of 0 to 12 months, which is at the top in the red box, you find that baby sleeps a lot every 24-hour period. So as a newborn, baby spends most of the time asleep, and this totals up to about 10 to 19 hours in a 24-hour period. Now, baby wakes for feeding, for diaper change, but falls back to sleep in between, and that's normal for a newborn. Now, baby gradually gets more awake and spend more times awake. And you can see that towards the end of the first year, baby basically sleeps for probably like half the time. So it totals up to between about 12 to 14 hours in a whole day. So the number of naps also would reduce. So as a newborn, you realize that baby naps very frequently in between feeding. This reduces to maybe about 1 or 2 naps of about half an hour to 2 hours each by the time baby hits about 1 year old. And in just a quick glance down my box, you can see that as your baby grows to a toddler, a preschooler, and beyond, the number of hours of sleep that your child needs would gradually reduce. And I think for example, for Shub, I think your kids are older, or for those parents who've got older kids, you know that, getting them to sleep enough is always a problem.
True.
Yeah, so some age unique features. So apart from the naps, you find that basically, I think it gets harder and harder as the baby grows up to get them to sleep well. Okay, and I will share with you in the next few slides how to sort of optimize these sleep periods.
Sure. Sorry, guys, you can take the screenshot of this particular slide. It's really valuable, and I guess you can always refer to this slide later. So we are going to put the slide for some moments on the screen. So if you guys want to take a screenshot, just grab it fast, because it's very detailed, and then it will be a good reference for all of us. Yeah, so go ahead, take a screenshot. Yeah, indeed, it's a very good reference. Like some of our participants are commenting. Yes, indeed, it's a great reference. So just go ahead and then take a screenshot. All right.
Okay, so babies and sleep. All right, so a lot of parents would come in sleep deprived in the first few weeks. So babies sleep on and off in the day, and there's no day and night basically. Baby wakes on cues for feeding. If baby's uncomfortable from a wet diaper, if it's too cold, too hot, that may affect baby's sleep as well. Sure. So a lot of times for new mummies, I always say that please try to sleep even if it's in the day, because you have to sort of follow baby's pattern for a while. And try not to say, oh, it's daytime, I don't usually take naps and I only want to sleep at night, because you realize that baby has no day and no night, and nights become very difficult because you're tired yourself.
So true.
So baby spends more time asleep than awake. And some babies sleep for longer periods. Some babies do short naps and then they're up again, and then they do short naps again. So every baby's pattern is quite different. So you would sort of familiarize yourself with your baby's own pattern, and take the first few weeks to sort of relax and sort of fit into baby's pattern, knowing baby's cues. When baby is sleepy, when baby is tired, you would know that to put baby down for a shut eye. So some babies sleep through the night pretty early on. Others don't for a long time. So this is a common question that I get, when will my baby ever sleep through the night? So let's go on to the next few slides, and then I think we can sort of address this later on.
Sure.
Okay, so I think we have a video coming up. So this is a very interesting video. I think for those of you who need to adjust your volume, maybe just put your hand to the button just in case it's a bit too loud or too soft for you. You can adjust it accordingly.
Turn off the water. She wakes up to turn it back on.
You've heard of Pavlov's dog. This is Pavlov's daughter.
She feels the temperature.
What is he doing?
And then she goes back to sleep. Do it again, Tyler.
Okay, all right. So in this
What was going on?
So in this video, you can see that this baby has learned to fall asleep with the sound as well as the feeling of running water. So when that is taken away or when it's stopped, you find that baby wakes up and wants the same condition to happen before baby can fall back to sleep again. So this is something what we call like a sleep association. So they've learned that, this particular thing happens when it's time for me to sleep. And this actually doesn't happen just in babies, but it continues on to toddlerhood and beyond. Now, what are the tips for parents? I think this applies to parents of all ages, okay? So make sure that your child gets enough sleep. I think sleep is very important as a child grows because it's important for their daytime functioning. It's important for their temper, for their temperament, for them to sort of learn things as much as they can when they're awake. Now, an appropriate bedtime is something like you can't expect a teenager to be having a bedtime of 8 p.m., for example. It's just not physiological. And it's not practical. And the other way around, basically, you can't expect a young toddler to be sleeping at 11 p.m. or 12 p.m. or 12 midnight just because everyone in the house is sleeping much later. So the appropriate bedtime really depends on the age of your child or baby. Now, in terms of the bedtime routine, this is something that is really important. And I always tell parents that come through my door that basically always start this early. So it's never too young to start a bedtime routine. And it's something simple, for example, a nice warm bath, and then maybe a short massage, change into pajamas, lights out, and then, it's time for baby to sleep. So now a regular sleep-wake cycle. So parents of young babies would usually say, there's no pattern to my baby's sleep at all. So when can I start training? So a regular sleep-wake cycle happens in most, but again, you see that it's not in all babies, maybe around the time of 4 to 6 months. Too young, you can try, but you may get a bit discouraged because it doesn't work. If it's too sort of late, you may find that it gets a little bit difficult as well. So if you ask me, what age can I start sleep training my baby? Maybe around the age of 4 to 6 months may be appropriate. If you think that your baby is a generally good sleeper and you want to start with good habits early, please go ahead. So some babies take longer than others. So again, every baby is quite different. So some of the important tips is in the next sentence, which is put your baby to sleep sleepy, but not fully asleep. So what I mean by this is basically you don't want to be rocking your baby till your baby's fully asleep and then try to sneak your baby onto a flat surface like the cot and then try to leave your baby there to fall asleep. Yeah. So baby basically gradually learns that, falling asleep is I have to be rocked to sleep. And that's something that an association that baby would associate with sleep as baby grows. And that becomes increasingly more difficult because baby gets heavier. So a lot of parents say that, baby's so heavy, it's very hard for me to carry my baby to sleep. So always get your baby sort of calm down, sleepy, and try to put your baby down on a firm surface when baby is sleepy but not fully asleep. Now, if you've got multiple caregivers for your baby, all right, it takes a village to raise a child. So often you have grandparents, parents, you've got helpers, or any other caregiver looking after your baby. Basically, you want to ensure consistency. So it can't be one parent's rocking the baby to sleep. The other parent basically says, no, I'm going to put my baby down on the cot to fall asleep. There has to be some matching of habits as well as so that baby doesn't get confused.
Sure.
Yeah. Okay, so some night symptoms or sleep symptoms basically to watch out for. Noisy breathing, or if you find that baby's using a lot of effort to breathe at night. Restless sleep, a lot of disrupted sleep, no matter how hard you try to sort of make things comfortable, but you find that baby's still not getting good sleep or rested sleep, then maybe it might be time to see your doctor just to make sure that there's no medical issues on board.
Okay.
Common things when baby is young, basically that can affect sleep. So some babies have got eczema, which is itchy skin, and basically the itch keeps baby up or sort of disrupted the whole night. Another common problem when baby is young is basically reflux, where there's acid, sort of coming up in the opposite direction. And that sometimes can cause some sleep disruption. Temperature in the room has to be comfortable. So for all parents, just make sure it's not too hot, not too cold. I think the guidelines for now basically suggest that you may want to sleep in the same room as your baby till at least about 6 to 12 months old, mainly for safety concerns. So again, the trick of putting your baby down when baby is sleepy is you want to feed, burp, and then put down to sleep without too much rocking and too much swaying. So you want to minimize all this sort of help on your bed. So you want to let baby learn to self-soothe, especially when baby's a little bit older.
Sure.
Okay, so another good tip that I usually tell parents that you can try as a start for sleep training is basically teaching the difference between night and day. So in the day, go ahead and play, stimulate baby, show flashcards, talk, sing. Don't worry about regular daytime noises, for example, the kettle or like mopping the floor or the fan. You know, certain household noises can still go on. But in the night or towards sleeping time, basically keep the lights dim, keep voices a bit more quiet. You don't really want to overstimulate baby when sleep is going to come next. And baby gradually learns that there is a difference between day and night.
Right.
Okay, so I think that's my last slide. So being a parent is no easy task. You can see that there's lots to learn and lots to practice. Play for baby when baby's alert and relaxed. Watch for signs of tiredness. So that may be a cue for you to put baby down to rest. Take a break from playing. You find that your baby's a little distracted. And take care of yourself as parents, physically, mentally, and emotionally, because it can get quite overwhelming, you know, whether it's feeding or sleeping or just changing diapers. Basically, it can get quite overwhelming in the first few weeks. All right.
Right. Okay.
Yeah.
So, Dr. Wong, we are getting amazing questions and so many of them. So our team is like, you know, scanning through all the questions, and then I think we will just start off with our Q&A session. Thank you once again. So much of information and so much of insights we all have gained. So even parents who are like having kids already, I'm sure even they have learned a lot. All right. So question and answer time, guys. I have one question right now in front of me. And a lot of people, by the way, ask this question. They're saying that breastfeeding mom, can she take COVID vaccination? And after delivery, when she should plan her COVID vaccination? So can she take COVID vaccination and can she continue breastfeeding after vaccination?
Okay, so I think the guidelines generally say that yes, you can take the COVID vaccine even when you're breastfeeding, but I think they have given a bit of a guideline to follow that you may want to stop for about 5 to 7 days after, just to err on the side of caution. But I think do check with which vaccine you're getting, as well as the latest updated guidelines, because you know that there are lots of different brands of vaccines coming up, and I think it's still sort of changing day by day. So in a sense, I mean, the answer is, in short, is yes, you can get the vaccine, but basically check, you know, just double check with your healthcare provider just before you do it.
Right. Okay, all right. Can we have our second question? Okay, so our second question is, so doctor, what are your thoughts on sleep training? Because people are saying that they've heard that it can cause psychological issues later in life. So if you try such methods, sleep training and all, will it be like some kind of issue later on when they grow up, or, you know, when they are like toddlers, or like, what are your thoughts on this?
Okay, all right. So thanks for the question. I think that's a common question that's posed by a lot of parents. Like, you know, if I do sleep training, is it going to do more harm than good? You know, and a lot of parents basically have reservations on, you know, how much to push this sleep training. So I think, again, it really depends on quite a few factors. I sort of in the short, basically, all babies and children are different. You can find that for those of you who've got more than one kid at home, you find that one child's a really good sleeper, but your other child's just a poor sleeper, and it takes so much effort just to put your poor sleeper to bed. So I think basically sleep training also comes with a lot of recommended methods. Again, you've got the cried out method that I think was mentioned by someone in the audience, and you've got the fervor method. You've got a lot of sort of in-between methods that have been described, and there are lots of books and information on this as well. So some parents go through book after book after book of sleep training, and at the end of it, they get so confused because they really don't know which method works for their child. And if they should even embark on any of these methods. So I think
Right.
basically the what I feel that is that basically follow what is a good sleep practice. Now,
Right.
in terms of whether is your child suitable for cry it out method, and whether leaving your child to scream and cry, is that going to cause any harm, even
Mhm.
down the road as your
Right.
child grows up? I think it's quite difficult to tell, but generally that's not something that is particularly popular, mainly because leaving a young child to cry and scream, a lot of parents have frustration about it. And I do agree that, it can be quite stressful for the entire family, not just the parent who's putting the child to sleep, mainly
Right.
because, neighbors, we all stay in quite close proximity to our neighbors in Singapore. And some parents tell me, my neighbor would probably be thinking that I'm ill-treating my child. And if I
Yes.
just leave my child to scream for hours, and
Right.
some
Right.
young children basically cry till they choke and vomit. So that's certainly not a very pleasant scene and not very comforting for a lot of parents. So I usually do something that is a little bit more gentle, so something in between. But again, we have to usually tailor it to each and every child and family, because it also depends on what the family's acceptance is and who's
Right.
putting the child to sleep. So I think what I can recommend universal to all parents is basically stick to good sleep practices. But whether or not one method works better than another for sleep training per se, I think it really depends. Yeah.
Right, right, right. Thanks so much, Doctor, for such an elaborate answer, because a lot of parents were actually interested to know this. We have one more question here, wherein some of them are asking that what to do if my baby sleeps lesser than the suggested time. So we had that chart, and then they find that their baby sleeps lesser than that. So will it have any negative impact? Because otherwise, the baby is growing pretty well, and the milestones and all are, of course, like, quite on time, but the sleep is lesser. So is it like any concern? Is that
Yeah, so
concern?
again, a very good question. So again, the numbers on the chart, please don't take it literally, in a sense that that's a guide for most babies. But again, from, if you think back, I think some of us require less sleep than others. Some of us require more sleep than others. Like, for example, some may say that, I just sleep for 5-6 hours and I can function really well. And that's my sleep need for the day.
Right, right,
Some adults basically say that, I can't do anything short of 8 hours, anything less than that, and I'll wake up really grumpy and like I look like, I'm not going to survive the whole day. So I think it really depends, but certainly I think that's a general guide. But if you find that your child is needing a little less sleep in terms of numbers, but if your child's otherwise behaving right, daytime behavior or during awake periods behavior is okay, your child's growing fine, then I think you don't really have to sort of match the numbers for his age. But
right.
certainly, I mean, it shouldn't differ by too much. For example, like a toddler shouldn't be getting like only 8 hours of sleep in a 24-hour
Okay,
period. I think
okay.
that's certainly a bit too way off. Yeah.
Understand, understand.
Yeah.
And like doctor, you were mentioning, each child is different, and
Yes.
even if the parents are same, but the two kids can be really different. So
Yes.
based on my personal experience, my daughter is like a very good sleeper, but my son is like, we call him always an awake boy, because like, so I think it also depends child to child. But
Yes.
yeah, so that reference point, that chart, I think we should always keep it in mind. And if the deviation is like too much, then I think we should take note of that, and probably consult your pediatrician, right? Yeah.
Yes.
Okay.
Yes, exactly. Should. Yeah.
Right, right, right. I am waiting for the next question. Is there any question? There are so many questions, by the way. So I think our team is checking which question to ask. So, okay, there you go. Yeah, this is another interesting question. So a lot of questions about sleep. So this is another interesting one. So like some of the parents, they say that co-sharing is good. Some of them, they want their kids to sleep like, individually in a separate room or something. So co-sharing bed sleeping. So doctor, personally, I mean, do you recommend this, and will it affect like baby's sleep cycle or something? So the babies and baby and the parents, they are sleeping together on the same bed. So it's a co-sleeping.
Yeah. So co-sleeping is, I would say, quite cultural. So in certain parts of the world, I think that's the norm. However, in other parts of the world, co-sleeping is like a no-no. So again, it really depends on the cultural background as well as which country you're from, and what sort of background that you've sort of grown up in. So I think co-sleeping has its pros and cons. I think that for those supporters of co-sleeping, generally they would say that it helps with bonding. And that's something that is precious time that they share with their child. And it gives their child security because physically the parent and the child is not so separated.
Right.
Now, just be aware about the dangers of co-sleeping, especially when your baby is young. So for parents who use blankets, pillows, which I think most parents, most adults do, you do need a bit of a pillow or a blanket. Basically, with co-sleeping, there are certain dangers that are important to highlight. Because you may be really tired at the end of the day, and no matter how light a sleeper you are, like a blanket that accidentally goes over a baby or a young child can be pretty dangerous. So that's something that is one of the main dangers with co-sleeping. Not just physical items, but also the body weight of an adult is much more than a young baby or child. So again, we don't sleep still in one position the entire night. A lot of times it's natural to move and to shift. So in that sense, again, it can be quite dangerous, especially if a big parent is sleeping very close or very near a young baby or child.
Right. Because if I have to talk about my own kids, I think for my daughter, we tried co-sleeping because elder child probably, so I was like quite possessive, and it was like very overwhelming for me. So she used to we used to practice co-sleeping that time, but for the son, we practiced let him start sleeping in a baby cot and then graduated to his own bed and so on. So yeah, that is one thing. Doctor, at this point in time, I just want to ask you one more question, because we were discussing about all like the babies and their milestones and what to expect at what time and so on. How about preterm babies? So this personally, I would like to ask this question again, because my daughter, she is a micro preemie. So she was born at 850 grams of birth weight, and then we really had a very scary time that time. And then the milestones and all for her it was all like kind of revised, because she was an ICU baby for 2-3 months of her life, and then we brought her home. So any advice, any suggestions for the parents who are probably going through a similar situation? We do have a lot of examples like this in Singapore, wherein the babies are preterm babies. So anything different to expect for such babies? So the pointers that you suggested today. So any tweaks to be done or any suggestions?
Yeah. So I think for premature babies, again, it depends on how premature your baby is.
Okay.
Yes, so in terms of development milestones, we would usually adjust it for the corrected age. And your doctor would be able to guide you on, how to sort of adjust it to the corrected age. And generally, you would want to use that as a better guide for in terms of to put it against the usual milestones. For premature babies, because I think if they're really born really small or really early, then certainly I think the medical problems sometimes may be a little bit of an obstacle to go through, especially in the first few weeks to months in some babies. So that may also have an impact on developmental milestones. Because some babies may have a feeding tube, and some babies may need help with oxygen for many months, even after going home. So certainly that would impact milestones, yes. Exactly. So I think in terms of developmental milestones, I think a good tip for parents is basically, it comes in 4 major domains. So one is gross motor. So gross motor is basically, remember the head control that I was talking about in my slides earlier. So head control goes on to a stronger body strength. So when baby can sit up, and then that progresses to standing, and then basically walking and running. So these are the gross motor milestones. In the next domain for developmental milestones is basically fine motor. So fine motor is basically hand-eye coordination. So that's when your baby basically develops a pincer grip, so where baby can actually pick up smaller items instead of a big grasp with the whole hand. And that's something that usually happens at about 8 to 9 months, that pincer grip that gradually becomes more and more refined.
Right.
So fine motor, so your toddler would be able to help with simple dressing, for example, like putting on clothes or even doing buttons as your child grows. So these are basically fine motor milestones that your child would develop to have. The third aspect, out of the 4 is basically speech and language, and this goes with hearing. So some of the premature babies basically do require some hearing aid early on. And sometimes basically this may sort of slow down the development milestone in that particular aspect. And certainly with hearing comes speech. So that sort of goes together. So the first words like Papa, Mama for an average baby is usually around the time of about 10 to 12 months old. But again, some babies are late talkers. So some may not say their first word till 1+. And some may not say their first word till 2 years old. So if you find that your baby, if it's a premature baby and corrected age, or if it's a term baby who you feel that development is a concern in any of these domains, then you may want to sort of see a doctor just to sort of get it checked early.
All right.
Yeah.
All right. So there are a lot of exciting questions that I see in a question and answer. So we're going to pick up some questions that will benefit a lot of parents. And yeah, so by the way, guys, some more surprises from Shopee coming up later. So stay tuned. There is a lot of questions you guys are asking. Very, very interesting discussion is going on. We are flooded with questions and the chat window. So, I think it's really going very, very nicely. All right, so let's talk about weaning and the baby food over here. So there are some babies who are allergic to dairy, and they are lactose intolerant, or they cannot take dairy and all that. So at this point in time, what are your suggestions, doctor? And also, like, people are asking that should I give sugar to my baby? Should I add some sugar in milk and then give them fresh milk? So there are some dairy related questions. So what if I'm giving dairy, fresh milk or something? Can I give sugar or something? Can I add it in the milk? Or if my baby is allergic to dairy, then what should I do?
Okay, so lots of questions in that. So maybe I'll address the first one.
Yes.
Okay, so I'll address the first one, which is basically if your baby is allergic to dairy and cow's milk.
Yeah.
So this may show up in various forms. A young baby with a cow's milk allergy may not gain weight, may have a lot of issues with feeding. For example, a very, very fussy, grouchy baby all the time. Or it can be something like blood in the stool. So for example, red streaks that look like blood very early on. Or it can be showing up as, for example, a baby who's got bad skin, like eczema, and the flares just get so frequent, and baby's skin just gets worse and worse. Baby takes milk most of the time, so the flares basically just come on very frequently. So it can take a very varied presentation, and lactose intolerance is something a little bit different. So a primary lactose intolerance is not very common in children and babies.
Okay.
But a secondary lactose intolerance can happen after your child has a bout of diarrhea, and the absorption of lactose basically gets affected. So that's a whole different topic from cow's milk allergy. So if you suspect that your child's having problems with cow's milk, so again, please consult your doctor early, especially if your child's not putting on weight, or if you find that there are lots of symptoms that you suspect may be related to dairy and cow's milk, because that can be checked through your history, as well as there are some tests that can be done. There are alternatives to cow's milk, so there's soy, and there are other sort of variations of formula milk that has been modified such that the body doesn't recognize it as a cow's milk protein anymore. So it's what we call hydrolyzed formulas. So again, you have to sort of seek your doctor's help in order to know what is suitable for your child after a diagnosis is being made.
Okay.
Sorry, I can't remember the last question. I think it was
Sugar,
something about sugar. Yes,
yeah.
okay, all right. So sugar-wise, yes, so generally under the age of 1, we wouldn't recommend to put additional salt and sugar in baby's food. So meaning that when you start weaning, you want to use natural foods that has natural nutrients of its own. And we don't really want babies to be getting additional salt and sugar because their bodies are not sort of ready to sort of accept all these additives. As baby gets older into a toddler, I would say still keep foods generally simple and try not to get your baby too used to very, very tasty, over tasty food. Because your baby would basically develop a taste for very, very tasty food and may start to reject natural foods, which generally have a milder taste.
All right, sure. So there are some more questions wherein people are asking that do I have to wake up my baby to feed at night? So the baby is sleeping, but since like we say that generally when they are infants and all, after every 2 hours they have to have some feeding and all, but the baby is sleeping. So should I wake up and feed, or I let the baby sleep? So
Okay.
it's food versus feed. So what should I choose?
Sure.
Yeah.
Yeah, I know it's tempting to sort of let your baby sleep because you just want some shut eye as well. Yeah. So I think if your baby is young, I would say that your baby still needs regular feeding day and night to keep your baby's weight increasing, as well as to sustain baby if baby is young. Now, a newborn baby needs to feed fairly frequently, and this is usually at an average of about 3 hours. Some babies get hungry a little bit earlier, so between 1 to 3 hours is usually the gauge for feeding when baby is in the first few months. Now, as baby gets older, yes, you may find that baby sort of adjusts into a pattern where baby can sleep for longer stretches, and that's what we call sleeping through the night. And then, yes, you can leave an older baby to basically sleep for longer stretches without having to wake baby up at, on the dot every 2 to 3 hours just to feed. That's something that you need to do if your baby is really young, less than 3 months old. Above that, I mean, you would still need to feed in the night, but you may be able to sort of see what baby's pattern is and adjust the feeding accordingly in the night.
Especially for working moms, because we are getting some questions from office going moms and all. They're saying that when they have to resume work after maternity leave, and then if they are trying to what should they do, because there is a schedule to be followed, but probably the moms, they will not be at home to follow the schedule and all. So instead of schedule feeding, is it okay to switch feed on demand, so that the caregiver and I mean, it's convenient for everyone? So that is another question that we have got from people. So at what age probably we should convert schedule feed to feed on demand?
Okay, so I think feeding on demand happens even from birth if you're breastfeeding. So for breastfeeding, you never know how much you're actually giving, because especially if you latch directly. So in that sense, you wouldn't know, are you feeding this amount of milk, every 2 hourly, 3 hourly, is basically on demand. So it may be as frequent as hourly to up to about 3 hours. So for young babies, generally, I would not recommend leaving the gap too long. So I would usually say about 3.5 to 4 hours. You may want to wake a young baby up to feed and not to sort of extend that period too long. Now, with regards to working moms who are planning to go back to work, one of the big issues is basically getting baby to get used to a bottle, for example, compared to directly latching. So give your baby some time to adjust, and for the caregiver who's going to take over you as the main carer in the day, some time, because if not, it gets pretty stressful, especially if mom's not prepared and mom has to start work. So always give maybe between about 3 to 4 weeks to adjust. Now, in terms of the feeding schedule after mommy goes back to work, I think it really depends on how old your baby is. And if your baby's already started on solids by that time.
Right.
So in terms of feeding on demand, you find that once you start solid foods, the milk intake may reduce because the solid foods do take some pick up some of the requirements in a day. So milk intake may reduce at that stage. So yes, you may find that you do not need to feed so frequently, especially if your baby's taking solids pretty well. If a baby is not started on solids, and I presume that maybe most moms go back to work about 4 months, when baby's about 4 months old, then feeding may not need to be on the dot like 1 to 3 hourly. You may be able to have a bit of a longer stretch, like maybe 4 hourly or so. And if your baby sort of stretches it out to about 5 to 6 hours in the night, and baby's older by then, it's probably okay, as long as your baby's putting on enough weight.
Right, sure. Thank you so much, doctor. Now, some of the questions that we are getting is because some of the parents, they suspect that their babies have got some conditions like probably they are getting a bit kind of breathlessness, or they're choking. So what are the warning signs that, parents have to look for? And just to share with my example once again, my daughter, she suffered from this premature apnea of prematurity. So she used to suddenly turn blue and then choke up on milk, and then it was seriously very worrying scenario. It used to happen anytime, day, night, and then we literally had to stimulate her. Sometimes I give her some pats and wake her up and make her cry and so on. So we have some questions wherein parents are asking, how do we recognize if the child is having probably a fit, or fits are happening, or probably the child is turning blue or choking. So what is something that we have to urgently do in that case?
Okay. So so a lot of questions in that. Let me try to sieve it out. Okay, so
sure.
Basically for so maybe we'll start with premature babies. So basically for premature babies, apneas or pauses in the breathing are more common than in term babies. Right. So it's something that you may face if your baby's born quite premature. So generally for the premature babies, usually caregivers are taught like a CPR sort of skills before baby gets discharged, mainly because of home safety, and just in case baby has a bit of a pause in the breathing, then basically that would be something useful for caregivers to know about. Now, turning blue is something that is not a good sign in babies of any age. So whether your child's a newborn baby, or a baby closer to 1 year old, or even a toddler, if you notice that your child's color is off, or baby's a bit purplish or blue, then that's certainly not a good sign. And please head to the nearest A&E if it's because it is something that is serious and needs to be checked out soon. Now, children can turn a little bit blue if they're cold and shivering. So if they have a high fever, that's another time when you may notice that your child's lips may turn a little bit off color. But again, if they're having a high fever, they're shivering, and they're otherwise sort of unwell, then again, these are signs that you need to bring your child to see a doctor straight away. Right. Now, choking is something that I think I did not sort of elaborate on during my slides on weaning, but certainly I think with the start of weaning, I think some babies, it's not uncommon for them to gag and want to choke, mainly because they're not used to that texture when they had been previously on milk. So whenever they're given some solids, some babies may be more prone to gagging, and they may seem like they're choking. So gagging and choking are a little bit different. So with gagging, baby makes a reaction like, he wants to sort of cough it out or choke on something. But, there's no change in color. Baby actually hasn't swallowed all the food. And basically, there's no concern that baby's not breathing right. So if you get a child who is gagging when you're introducing a new food for the first time, don't be discouraged. Try again, a short while later. Maybe he just needs a bit of time to get used to the taste of that new food. Now, choking is when baby swallows and really gets choked. For example, certain foods are a bit more dangerous than others. So We were on the topic of baby-led weaning earlier. So certain foods that are not so suitable for baby-led weaning would be an apple, for example, because an apple is generally quite firm to hard. So if baby successfully bites off a piece of apple, that can cause choking because it lodges in the throat, and you may find that baby swallows and then starts to choke. So certainly something of safety that, certain foods are not so suitable, especially when baby hasn't had teeth and is not sort of able to chew.
Right. Thank you so much, doctor, because it's just like so interesting and so informative, and then like you are really answering so elaborately, and then it's really our heartfelt thanks from all the parents who are attending today, actually. So,
My
all
pleasure.
right, guys, now let's move on to our next topic. What is there on our next slide? Can we have the next slide, please? All right, it's Shopee time once again. So yes, take a look at it. Shopee vouchers up for grabs once again. First 200 webinar participants, they are going to get $3 off. No minimum spend needed. Just go ahead and shop for your babies, kids, toys, whatever that you wish to purchase, and there are terms and conditions apply. The vouchers are going to be expiring on 23rd May. So please go ahead, flash your mobile cams and then scan that QR code. We are going to put the link in the chat window as well. So go ahead and just click on that link as well, and just go ahead and Shopee. All right, we're going to give you some few moments. Go ahead and grab the vouchers. And yeah, so we'll just wait for a while. Yes, and wait for some more time. We are not yet done. So don't thank us so early, guys. Hold on for a while.
Hello.
Yeah, just hold on for a while.
Somebody called me.
All right. So thank you so much for all of you attending today's webinar. Singapore Parenting Festival is proudly presented to you by MediaCorp and Asian Parent. And this festival was made possible by our key partners. Our official e-commerce partner is, of course, Shopee. And we would like to thank our platinum partner, Walsh. Our gold partners are GSK Scots, Dumex Dugro, Nestle Milo, Nature One Dairy. And let's thank our silver partners about Similac, Pampers, and Nestle Nan. Our content partners are Center for Fathering, Moms for Life, and Dads for Life. Thank you everyone once again for joining us today. There are going to be some more webinars, so please do sign up. Tomorrow we will see you 7:30 p.m. to 8:40 p.m. for health and fitness of your growing up child. We have got some amazing speakers for this webinar as well. Just go ahead, sign up for it. The recording for our today's webinar will be made available on Singapore Parenting Festival 2021 website. Give us some time. It will not be immediate today or tomorrow. Wait for a while. But yes, recording you will find later on the website. So thank you so much. Do visit us at spf2021.theasianparent.com. Thank you so much. Thanks a lot and have a good night. Stay safe, everyone.